Hello everyone, it's Abdullah again, and one more question with me about the MRCS. What are the following statements related to gas gangrene? So today we're talking about gas gangrene. Is untrue. Always be careful reading the questions. So here we will be doing this. So necrosis and putrefaction. This seems correct. Okay. Causative pathogen may be detected on normal perineal scan. Well, possibly, but we need to know the causative organism. So ask yourself, what is the causative organism? Because, by the way, this way is when you're studying for the first time. Do not do that in the second or third time. Treatment is with low dose antibiotic, penicillin. This is very less likely. Hyperbaric oxygen may be beneficial. This is kind of true. Clostridium perfringens, if you remember that, is a recognized cause, which is true as well. So this is your way of solving in the first time, just to remember and memorize everything at the same time. So low dose does not seem correct. I think it requires debridement, okay, and high dose of antibiotic. But before that, let us discuss the um, two things. The first thing is necrotizing fasciitis. So necrotizing fasciitis, from its name, firstly, it includes the fascia, and secondly, it causes necrosis. And we know that this is some kind of infection to the deep tissue, soft tissue, obviously, and have necrosis and fascia is involved as well. The causative organism of necrotizing fasciitis, the commonest of all time, is Streptococcus. However, multiple organisms might be involved, including bacteriides and other organisms, such as the gram-negative bacteria and MRCA. Okay, MRSA and gram-negative bacteria. Obviously, all of them are very intense and bad bacteria. The treatment in necrotizing fasciitis, what is the presentation first? The presentation presented by skin might be a bit normal, but the patient is systematically unwell, like his observation are significantly deranged. Okay, and on the other side, you might find the swelling in the skin. These also, even the skin, this is a swelling of soft tissue. Even the skin might have some bully sometimes, or discoloration, okay, or edema, okay. What do you do for this patient? This patient requires debridement and take culture and sensitivity while you're doing that, and treat the patient with broad spectrum antibiotic until the culture arrives, and treat them by the specific antibiotic. So again, this is advanced soft tissue infection, fascial necrosis, and it involved this underlying background of immunosuppression, like diabetes, polymicrobial, MRCS seen. Streptococcus is also the commonest one. The second thing we'll talk about is something called Melenius gangrene. So this is basically gangrene of the tissue, and gangrene means death of the tissue. Okay, it's similar principle, but the infection. So it's similar principle to what we just mentioned, but the infection is more superficial. Okay, there's also something we call um to see here fournier gangrene, necrotizing fasciitis, but it's more in the perineum, and polymicrobial, but mostly E. coli and bacteriides are involved. Fever and pain, cellulitis, edema, induration, and numbness. This is the presentation that we just mentioned. You look here, bully, and also we call it the dish washer. The dish washer fluid is coming up, okay, from this area. So, just a quick recap. We're talking about necfash or necrotizing fasciitis. We know that the story is it happens in immunocompromised person. presented with subtle presentation, apart from the deranged, systemic, systematically deranged, and you need to do debridement and a stronger antibiotic for these patients. Have a good day.